Good afternoon, everyone. My name is Chrissy Matheson, and I'll be your moderator for today's press briefing. Before we begin, I'd like to introduce the Premier of Nova Scotia, the Honourable Iain Rankin, who is celebrating his birthday today. Happy birthday, Premier. And Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Go ahead, Premier.
Thank you, and good afternoon, everyone. I just want to acknowledge the passing of Prince Philip earlier today. Prince Philip was no stranger to our province. In fact, he first came here as a young naval officer during the Battle of the Atlantic. And then later in 1958, on an unofficial visit to other parts of Canada, he broke away from his program to meet with the families and the survivors of the Spring Hill mine tragedy. The last time he was here was in 2010 to celebrate the 100th anniversary of the Royal Canadian Navy. Our condolences go out to Queen Elizabeth and her family. Members of the public are invited to sign a book of condolences at Government House from 10 a.m. to 4 p.m. until the memorial service, which is in about 8 days. As well, people will be able to sign the Government of Canada's official condolence book, which will be posted on the Lieutenant Governor's website. And I'll be going down later today to sign the book. Today we are announcing 2 new cases of COVID-19. One case in the northern zone related to travel outside of Atlantic Canada, and the other in the central zone under investigation. As of today, there are 41 active cases of COVID-19 in the province. Now for a vaccine update. Yesterday was another record day. 8,503 doses went into arms. At the end of the day, 348 doses have been administered total. 96.2% of healthcare workers either received their first dose or second. Nova Scotia is a leader in this area. We are also a leader in long-term care vaccination. All licensed long-term care homes are expected to be fully vaccinated by the end of April with 2 doses. And private facilities will have had their first dose by the end of April with their second dose in May. This week, we're on track to administer 40,000 doses of COVID-19. Next week, we'll administer 50,000 doses. In fact, there are still openings in some areas next week. That's why we're opening to the age of 65 and older now. You can go online or book your appointment on the phone. Given the number of people in this age group, it's likely we won't be able to drop down an age cohort in the next few weeks. We'll monitor uptake and go from there. I know there are people out there who are eligible to get their vaccine and have not been able to get an appointment yet. But as Dr. Strang said on Tuesday, vaccine is being distributed across the province equitably by population. Staff already started to add more appointments to locations across the province. More than 45,000 appointments will be opened up for the week of April 19th. I also wanted to provide an update on how vaccinations are going with the Mi'kmaq elders. We continue to work closely with health directors and health centers in the 13 communities, Mi'kmaq Health and Wellness, and the Mi'kmaq Native Friendship Center to roll out the vaccine. As of this week, Mi'kmaq elders who live in the 13 communities have received both their first and second dose. On April 23rd and 24th, the Mi'kmaq Native Friendship in Halifax will also offer a vaccine clinic for urban Indigenous elders who are over the age of 55, as well as some knowledge keepers who live in the HRM area. Planning is also underway for the next phase of vaccine rollout in First Nations communities. It will start with Mi'kmaq elders 55 and over who live outside of the communities and expand to all community members who are over 16. I want to take the opportunity to acknowledge the continued leadership and hard work of the health directors and health centers in the 13 communities, Mi'kmaq Health and Wellness, and the Mi'kmaq Native Friendship Center. We said we'd ramp up doses going in arms as supply from the federal government expanded, and we've done so. We said we'd increase capacity across the province, bringing more and more locations online, and we have done that. We said we'd move through age groups weekly, and we have done that too. We said we'd support the most vulnerable groups first, those most at risk of severe outcomes of COVID-19, and we have done that by focusing on age and working with communities to organize outreach clinics. We have built a vaccine program that is equitable, flexible, and reliable, and our rollout is on track. Now over to Dr. Strang.
Thank you, Premier, and happy birthday, and good afternoon, everybody. And I want to start by thanking the Haddad family for my tie today. I attended the grand opening of the new Peace by Chocolate store in Halifax yesterday, and Tariq Haddad told me how welcomed, cared for, and safe his family felt when they arrived. And it made me think how Nova Scotians have responded to this pandemic. The way we've cared for one another in our communities has helped keep this province a safe place for all of us. I have a few things I want to cover today, so I'm going to try do my best to be brief. As you know, we've done some pop-up testing at Kings Wharf apartment complex recently in Dartmouth, given the connection to a COVID-19 variant case. I'm very pleased to be able to say that no additional COVID cases were identified through all this testing, and it is absolutely safe to visit the people and businesses at the Kings Wharf location. The Nova Scotia Health Authority did announce some targeted testing for the South Shore this week for the areas of Hebbville and Middlewood, simply as a precaution after we've had a few cases in these communities. Those cases are linked to travel, and there's no known exposure in the community, but again, as a precaution, we're moving in and encouraging anybody who lives in those communities to be tested. I just want to, in the lines of testing, I want to give a quick update on our overall testing strategy, which has been an important part of how we've managed the pandemic so far. Since the majority of our cases are related to travel outside of Atlantic Canada, we've added another layer of protection by strongly recommending testing for travelers who still have to quarantine for 14 days upon arrival in the province. So for any of those individuals, we're asking them to get tested on their day 1 or 2 of their after arrival, and then again near the end of their quarantine on day 12, 13, or 14. People in this situation are allowed to leave the quarantine for this testing, and their quarantine does end at the end of the 14 days, even if they have not yet received their second negative test result. There are also some people who are exempt from quarantine, like airline crew and military. We're also asking them to get tested 3 times when they come home. We're also expecting them to complete the Nova Scotia Safe Check-in form so that we know who is coming and going, and will follow a specific protocol that limits close contact with others in their first 14 days here in the province. That protocol has been communicated to these organizations and is on our website for people can see that for more details. Now I want to mention a few things about the vaccine rollout. I know people are still having challenges booking appointments online and through the toll-free line. Everybody wants to get vaccinated, and that's a very good thing. The reality is, however, that we still have limited supply. But that supply is increasing, and as it does, we will be continuously adding new appointments into the system and getting vaccine into arms. We will not announce specific dates or times, because that just builds up a whole group of people who are rushing to book their appointment at the same time when those become available. So if you're not able to book, we just ask you to keep going back and looking every few days. We will continue to add more appointments, both online and in the phone line, as supply continues to increase. We are working on some improvements on the online tool that will make it more easily show Nova Scotians where there are openings. For instance, we hope by next week we'll be implementing a postal code feature where rather than having to scroll through every single clinic, you can put in your postal code and find appointments and clinics that are linked to your specific postal code. And if you do not see appointments at the clinic of your choice, just check back in a day or 2 to see whether more have been added. Everybody will get an opportunity to be immunized close to home in the coming weeks. And I'm still hearing reports of people calling clinic locations directly. I know that people are eager, but please do not call the clinics, whether it's your pharmacy clinic, the public health community clinic, or the physician clinic. Those locations cannot book appointments. You can only book appointments online or through the toll-free line. And if you don't see appointments in your area when you're online, please don't then pick up the phone and call the toll-free line. The operators have access, whether it's on the phone or whether you're online, they have access to the same list of open appointments. So there's no advantage. You're not going to get anything new by then going from online to the phone. There is no extra pool of appointments for the phone line. And as I said, as supply increases, and it continues to do that, available appointments will increase as well. However, at this point, because of that limited supply, we cannot add more appointments at every single clinic in the province. Every time we get more vaccine, there's simply not enough. So we are distributing the vaccine according to age-based population estimates, and we're rotating shipments between different parts of the province. Our goal is to make sure that we're building population immunity on a fairly equitable approach. So no one part of the province will get much further ahead than any other part of the province. That means there has to be some ebb and flow in local availability. But you will get your local availability over the next few weeks. I wanted to explain that because a lot of people are sending in questions saying, well, you got more vaccine, why am I not seeing more appointments in that area? We rotate around vaccine supply and spread it around equitably across the province. That's an important goal around equity. And again, I am encouraged that so many Nova Scotians want to get vaccinated. That's great, but I'm asking for people's patience. You will get your opportunity in the coming weeks. And then I just want to talk a little bit about our overall vaccine plan as well. We've always said that our plan is subject to change based on vaccine supply and evolving science. When we first developed our plan, first and second dose had to be given between 3 to 4 weeks apart, which meant that it would be the end of September before everyone had had an opportunity to get their first dose. But the science has now changed. Now we can extend the time between doses to 16 weeks, which means that we can get all eligible Nova Scotians their first dose by middle to late June. We'll move quickly through our priority and age groups, or we'll move much more quickly now because of that through our priority and age groups. So we're making some changes to what people have seen as the phase 2 priority groups. Originally, rotational workers, long-haul truckers, and employees who worked in large food processing plants were going to be vaccinated in May and June as part of that so-called phase 2. Now they'll be able to get their first dose much more quickly and conveniently as part of their age group through a community pharmacy or primary care clinic. So by making their shift, they will get access more quickly than they would if we were to do the work to set up specialized clinics for them. So those groups that were identified as priority in phase 2 based on occupation will now get immunized faster through just following our age-based approach. And in closing, I want to go back to what Tariq Haddad said. Nova Scotians care about one another. The events that we've experienced together over the past year and how we have responded have proven that to be true. We need to keep caring about one another and keep following public health protocols while we build our immunity to COVID-19 through vaccination. It's quite strange, actually, to be in Atlantic Canada these days in some ways. We are lifting restrictions in a few places while others are significantly locking down in other parts of the country. But our approach has always been about balance. We felt it was safe to make the modest changes that we announced earlier this week, but our border control measures, limited and safe socialization, and following the public health protocols continue to be important and will be for some time. This has been a long road, and I know people are tired, but the next 2 months are critically important. We need to find the resolve and resilience to keep doing what is keeping us safe and making us an example worldwide. Together, we can remain Nova Scotia strong. Chrissy.
Thank you, Dr. Strang. We'll take one question and one follow-up in the time that we have for today, beginning with Shayna Luck with CBC.
I'd like to ask you about the loosening of restrictions on shops and also at the Newfoundland border that happened earlier this week. Our case numbers are very low, but there are still people who are very anxious about the possibility of a variant coming in. What gives you the confidence that now is the right time to make that decision?
Well, public health, first of all, recommended that we would be able to do so in a safe manner. And our approach has always been that we do that cautiously. So we started, New Brunswick was the first jurisdiction that we saw that opportunity once Newfoundland's cases were under control and brought to zero, in fact, and then just keeping them very low. meant that there was virtually no distance between our epidemiology and theirs. So I didn't feel that it was appropriate to put a further burden on Nova Scotians, making them self-isolate when there was no science to back that up. Similarly with the restrictions on retail and gym facilities, as long as we have that physical distancing in place, which is still required, that was something that was comfortable with public health, and that's how I'm going to continue to make decisions.
Go ahead with your follow-up, Sheena.
Just following on the projected date for the Atlantic bubble, what meetings do you have that are scheduled in the next week to talk about finalizing that? What date do you expect to actually finalize it?
Right now, it's April 19th is the date, so we're comfortable with no self-isolation within Atlantic Canada. What's happening outside of Atlantic Canada is very different from here. We're watching this on a daily basis, and we will not hesitate to shut our border down if there is an increase in activity near our borders in our other provinces, but so far there hasn't been, and we'll watch it very closely.
Next question will go to Alicia Draus with Global.
Thank you. I'm just wondering if there's any word on the Johnson & Johnson vaccine and possible supply for the province?
We've had no confirmation of either specific amounts or dates of delivery from the federal government. We know it's been approved by Health Canada, but beyond that, we've had no further detailed information at all.
Go ahead with your follow-up, Alicia.
And you had mentioned that next week we're moving down to that 65 and over age group, but that it's also one of the largest age groups, so it'll be some time before we move down further. But from what I remember, the original plan was to kind of be going through age groups every week, so does this push back the rest of the age groups?
No, in fact, we introduced 75 to 79 and then 70 to 74 earlier than we actually anticipated. We know that this is a much larger group, so we need to make sure that there's enough time with enough supply to get through a good proportion of that group before we go beyond that. And I just want to correct that it's not next week, it's today. Starting today already, we've had people 65 to 69 have already booked their appointments.
Next question will go to Lindsay Armstrong with All Nova Scotia.
Thank you. First, a question for the Premier. I'm wondering if you can help us understand why observing Prince Philip's death meant the early adjournment of legislature this morning. I'm just wondering what the protocol is for this.
Yeah, that was new for me as well. Basically, protocol approached us about what was happening in other jurisdictions within our country, and we were aware that at least one at the time, Prince Edward Island, chose to do that. So we're following on the custom that was already set there, and we felt as a collective in the legislature that we would, out of respect for the passing, just delay our business for today.
Go ahead with your follow-up, Lindsay.
Thank you. Recognizing that the outbreak in Edmundston, which is now largely variant cases, continues to grow, is there a plan for what April 19th might look like if that outbreak is still a concern? Would there be an Atlantic bubble, but no travel to that region? Would there be a way of having New Brunswick be sort of addressed separately? What is the plan for that?
Well, of course, I preface that with any discussion would have to take place with with Dr. Strang and our team, and April 19th as of now makes no difference to us because we're open to all Atlantic neighbors. There's no requirement to self-isolate. If that changes, that will be because of activity that moves beyond that region of New Brunswick. We would be having a different conversation if they were in a red zone anywhere close to our province. And again, the benefit is we can move extremely quickly to shut down as we have been over the past year, and we'll continue to make sure that we address those situations immediately.
Next question will go to Tim Biscay with the Halifax Examiner.
Dr. Strang, I totally understand the logic of not doing the phase 2 for the workers. However, looking at recent numbers, the demographics yesterday, it sure looks like all 5 of the cases were young men. One could infer they're rotational workers. Would there be any desire or any thought to getting rotational workers vaccinated ahead of schedule?
So first of all, you look at the average age on the I'll talk about the other workers, long distance truckers, the food plant workers. They have actually sectors that we can work with, and we know that their average age is about 55. So they're going to get immunized quickly. Rotational workers, there is no sector, so it's much harder to actually identify rotational workers. How do you prove that you're a rotational worker and set that up in our system? But we know many of them are also in the already eligible in the 55 to 64 for AstraZeneca. So we'll be and we're on target within the next number of weeks. That by the time we get into the end of May, we're at the 30-year-old age group. So trying to set something up specific for rotational workers would actually, by the time we got that up and going, the vast majority of them are going to be eligible through their age group anyway. So it's much more efficient and effective for us to continue to move everybody through that age-based process rather than trying to set up specific other processes.
How about your follow-up, Tim?
I have an AstraZeneca appointment for next week, and a lot of people have asked me this, and it's of concern to me as well. No one under 55 can get AstraZeneca, and no one over 64, and yet our second doses are scheduled 15 weeks ahead of time. Might that be sped up?
Actually, the AstraZeneca has actually been licensed for a longer, I think it was a 12-week interval already from its initial license. So we're looking at already, starting to look at our main focus is still on first dose fast, but we're starting some conversations about if you hit our targets, which we certainly expect to do, by getting everybody immunized who wants to get immunized by mid to late June, then we want to then start moving into people in some sort of prioritization right away in July, and so doing that would actually mean moving people up earlier than their 4-month appointment now. We have to understand that the NACI recommendation doesn't specify 4 months. It says up to 4 months. So there's nothing that would stop us moving people up if we're able to do that. What our first priority is still first dose fast for everybody, and then we'll consider how we then move people as quickly as possible into starting to get that second dose.
We'll now go to the phone, starting with CTV's Natasha Pace.
Thank you. Dr. Strang, I just want to clarify, were long-haul truck drivers always in phase 2 of the rollout? I was speaking with the association earlier, and they had indicated that Nova Scotia was the only province in Atlantic Canada that didn't include them in phase 2. So I just wanted to clear that up. Were they always in phase 2?
Yeah, they've always been part of phase 2.
Go ahead with your follow-up, Natasha.
Okay. I also just wanted to check on the mobile clinics to help vaccinate the homeless population across Nova Scotia. How are things going? How many doses have been administered to date, and how many clinics are actually running?
I don't have those specific details. What I am aware that we're doing those clinics, and I've heard nothing but good news coming out of those clinics.
We'll move on to John McPhee with the Chronicle Herald.
Thank you. Dr. Strang, you mentioned that the SoSure testing that's being done today, I believe, is a precautionary measure as part of an investigation of cases. Can you elaborate on what the situation there is, why this move to do the mobile testing, which I think is a little unusual, why that was done?
No, it's not unusual at all. It's what we've done in many different circumstances. If you recall, we did it associated with a school and then a community up in the eastern part of the Annapolis Valley. We've used similar approaches, not always with a mobile unit, sometimes a standing unit, a community clinic in Beaverbank and in Uniacke and in Lower Sackville. It's part of our normal approach. When we see a few cases in a community, even though all our follow-up is showing there hasn't been any real risk of exposure in the community, we're not going to just rest on that. We're going to go in and bring in, through whether it's bringing in a mobile unit or working with a community to use a community location, to bring in the ability for people to very easily access testing. We want to test broadly and widely around cases. That is the approach we've taken for all through the second wave, and it's an approach that has shown that it works. It helps helps keep us out in front of in any community, helps keep us out in front of any possible virus activity that we're not aware of through our follow-up of cases.
Go ahead with your follow-up, John.
Thank you. This is again for Dr. Strang. You are now strongly recommending that travelers get tested, given the number of travel-related cases recently. Why not make that mandatory?
So there's a whole bunch of challenges when you make it mandatory. How do we actually enforce that? How do we actually have the legal capacity to actually do that? So we believe that all along we had the same question about other aspects of our approach, whether it's masking, etc. We've taken a very different kinds of approaches where we believe the vast majority of people, if we ask them to do something and explain why they need to do it, they will do it. So we're going to take that approach. We're just emphasizing the need for the travelers and helping them understand the rationale. We've made it clear in the public health order that, because we were getting questions, well, how do I get tested if I have to be quarantined? So we've made it clear under the order that they're allowed to technically come out of their quarantine simply to get tested.
Next question will go to Victoria Walton with the Coast.
Thanks. Dr. Strang, I'm wondering, I know previously we talked about having to get up to that 10,000 a day or 12,000 a day mark to be able to meet all the adults being vaccinated or who want to by June or whatever the target date is. Are we still on track to approach that 12,000 a day? Is that still our number at the highest that we'll be aiming for?
Absolutely. That's our plan. Those are our planning parameters. That's based on what we expect to receive, what's been predicted from the federal government on the amount of weekly vaccine allotments that we need to be able to have a capacity for that 10 to 12,000 a day. And we've built our program to ramp it up so we can get there. In fact, if you recall back in the technical briefing, there's a period of a few weeks at the end of May, early June, where we would have, if needed, additional human resource capacity beyond our anticipated supply. So if for some reason we get extra supply during that time frame, we've actually built a program where we can very quickly meet that additional vaccine supply, which would be great news because it would move all our projected targets earlier into June.
Go ahead with your follow-up, Victoria.
Thanks. And the Premier said something about how we won't be able to drop down to the next age cohort within the next few weeks. Does that mean that something will be delayed going down to the next age cohort, or is that the plan all along?
Oh, it's simply because of the size of that 60 to the number of people in that 60 to 69-year-old age group. That given matching up the number of appointments that would be needed with vaccine supply, that we're going to have to stick with this for a little bit of time, longer than older age cohorts than we've done so far, simply because of the greater size of this age cohort. It doesn't mean we're delaying anything. We anticipated this all along. Part of it is, as we know exactly how much vaccine we're going to get in the next couple of weeks. We've always known the size of this cohort and how many appointments we'd need. We now have a better prediction of how much time it's likely to take to be able to move through this cohort, given what we know the amount of vaccine we're getting in the next couple of weeks.
Next question will go to Adam Cook with Tell All Community Television.
Thank you very much, Dr. Strang. Could I please get some clarification from you on the issue of vaccinations for long-haul truckers? And in particular, you had mentioned near the tail end of your remarks during the initial part of the briefing that these folks would be able to go to pharmacies and community clinics once they'd reached their particular age bracket for the individual truckers. I'm just wondering, was this always the plan for phase 2 in terms of this particular industry, or has that changed?
No, if you recall, when we built phase 2, that was in anticipation, as I said, that we were having to do first dose all the way through the summer into September, and at the time we said that because of some of the unique risks, that we were going to build a specific streams, if you will, for the long-haul truckers, rotational workers to access vaccine through May and June. We now know that, so they're still on target. In fact, many of them are going to be immunized now in April. But because we've been able to speed up our whole vaccine program, we can still maintain that as that May or June target, or even earlier, by just simply having them slot in when their age cohort becomes available.
Go ahead with your follow-up, Adam.
Yes, still with this issue, I know obviously this could be impacted by the number of cases that Nova Scotia has in the coming weeks, but once the vaccinations take place for members of the long-haul trucking industry, does that change the isolation requirements for them in terms of returning from areas such as central Canada or the U.S.?
So we're looking at general. We're in Nova Scotia, as well as part of national conversations about the evolving evidence around protection against asymptomatic travel by being immunized, and starting to look at how do we take different approaches to people, whether they're 2 doses of vaccine, 1 dose of vaccine, or no vaccine. So we're starting to have those conversations about, and it's not just specific to long distance truckers, it's general groups of people, or travelers or otherwise. Do you have different types of public health measures, whether depending on their vaccine status?
Next question will go to Jean Laroche with CBC.
Hi, Dr. Strang. Sorry to be sick about this, but I'm like Alex. I'm having a hard time understanding what the change is for the phase 2 people and the truckers. Are you saying that you were originally going to screen them, now they just go into the queue with the rest of us? I'm sorry, I'm confused.
Exactly. So we had initially said that we would need to develop a specific approach for these groups in May and June, based on that original phase 2, knowing where we're going to be, and that was based on anticipating being all the way to September before every Nova Scotian got their first dose. Now every Nova Scotian is getting their first dose by middle of June. We don't need a unique approach for these groups to get them immunized in May and June. If they slot in with their age group, many of them now are eligible for AstraZeneca, and the 55 to 64-year-olds. So many of them are actually getting access to vaccine earlier than they might have gotten if we'd followed that initial approach. It's simply because our whole vaccine program has been sped up significantly that we can focus almost everybody simply through an age-based approach.
Go ahead with your follow-up, Sean.
All right. Appreciate you clearing that up because I was a little sick. I'm going to ask you a 2-barrel question. One's a short snapper. How many people are in that 65 to 69 age group you keep talking about being the largest cohort? And then I want to ask you the real question, which is Heather Morrison, your colleague over on the island, has talked about different restrictions for those who have been vaccinated and those who have not. Can you talk a little bit about whatever conversation you have had internally here in Nova Scotia about a different approach, whether or not you're vaccinated or not, and restrictions?
So your first answer, I should know the number. I don't have that number off the top of my head. If you Google census data, you can come up with that pretty quickly. But it is substantially larger than the 70 to 74 or 75 to 79. So the conversations we're having, as I said, both internally, I've asked my team to start to look at. So you look at it some different ways. You know, if somebody's traveling, do you have a different type of quarantine, or maybe they don't need a quarantine if they're fully vaccinated versus unvaccinated? If somebody is exposed to COVID, maybe you don't need to put them under isolation, post-exposure if they're fully vaccinated. So there's a whole bunch of different ways that it plays out under the general umbrella of public health measures that people have to follow, whether it's for the general public, for travelers, or for people who are known contacts of cases. That given that we know the stronger evidence now about the protective effects of vaccine, that those people are at much lower risk of ever developing COVID in the first place. So maybe you don't need to be as cautious in all these public health measures. There's been no final decisions made on that. This is a very active space of conversation within each province, and we're having it's a major topic of conversation at the national calls that I'm on 2 or 3 times a week.
Next question will go to Nicholas Seguin with CBC.
I've seen a lot more anti-vax or like COVID denying opinion proliferating on social media, and I know in the States they're starting a campaign to deal with this. Do you think this is a problem in Nova Scotia, and if so, how do you plan to combat that?
So I think, you know, we all know that there's a small proportion of people who are like totally anti-vax. There's lots of people who have questions, and so we're going to focus our attention on the people who have questions, because those are, you know, giving them good information. So we've already got a lot of information on our website and other places that, as I've talked about, we are slowly ramping up and increasing our broad communication strategy to Nova Scotians. We're very cognizant of we don't want to build that has to be timed well in terms of our increase of supply. We don't want to create a demand that we can't deliver through our supply and our program. So that's ongoing and will increase as our supply increases, and ensuring that Nova Scotians have an opportunity to get good, solid, factual information to help answer many of their questions. I firmly believe that most Nova Scotians understand the importance of getting vaccinated. All they need to do is we all look and see the news and what's happening in other parts of the country, let alone the world, and how devastating COVID can be. And I think we need no further evidence than that of the importance of everybody getting immunized. And I fully believe that Nova Scotians, by and large, understand that and will make the right choice for themselves to protect not only themselves but to protect each other.
Go ahead with your follow-up, Nicola.
So you mentioned it's kind of strange being here while we're opening up and other places in Canada are locking down more. How does it feel to be looked at by the rest of the country as the gold standard of COVID management? And what challenges to this success do you foresee in the coming months?
So a couple of things. I mean, I recognize that we're in a very privileged place, but that privileged place has only come because of the hard work and the commitment of every Nova Scotian. So I feel proud to be part of that, to be a Nova Scotian, that we've collectively made this commitment and show an example about how we can, by caring for each other and making sacrifices collectively, what we can achieve. But also understanding that we need to really hang on. We need to hold on to that sentiment for the next couple of months while we get the protective effect of the vaccine built in. Then we hope we're in a different position where we can slowly become more relaxed.
That's all the time we have for questions today. Go ahead, Premier.
Thank you. I just want to close by giving a special shout out to those that were operating at the Emmanuel Baptist Church in Upper Hammonds Plains for our first clinic for African Nova Scotians. This week we were able to vaccinate 250 people over the age of 55. From what I've heard, the atmosphere was outstanding, an excellent turnout from the communities of Upper Hammonds Plains, Beachville, Lucasville, and Cobequid Road, and fantastic volunteers from the African Nova Scotian communities, including teenagers who were on hand to greet people, hand out water, and make sure everything ran smoothly. This was a big effort led by community leaders, the Health Association of African Canadians, and the Association of Black Social Workers, with support from Nova Scotia Health Authority and the Department of Health and Wellness. So congratulations to everyone on that work. A big thank you to those who were vaccinated, the church for being such a great host, and to everyone involved in organizing and volunteering to make this clinic happen. Another clinic is taking place on Tuesday and Wednesday at the New Beginnings Ministry, located in Cherrybrook, for Preston Township community members who are over the age of 55. Thanks again to all Nova Scotians for continuing to follow public health guidelines, and have a great weekend.